Through this study, we wanted to know how First Nations children were doing in Manitoba. The study included children living on reserve and also those living off reserve, living in all parts of Manitoba. We wanted to know, how are First Nations children doing? How is their physical and mental health? How often are they involved with the justice system? Are their families involved with social services? And how are they doing in school? To find out how First Nations children were doing, we used data housed at the Manitoba Centre for Health Policy, or MCHP. Researchers at MCHP joined forces with researchers and leaders from the First Nations Health and Social Secretariat of Manitoba and the Manitoba First Nations Education Resource Centre. We also work closely with an advisory group of knowledge keepers who are respected elders in First Nations communities, and with our Manitoba government partners. It's been a real honor and privilege to work with our First Nations partners on this report focused on the health and well-being of First Nations children. What did we find? We found large inequities in nearly every area of First Nations children's lives. First Nations children living off reserve fared better than those living on reserve. It is important to understand that social, economic, and environmental reasons for this, generations of racism, colonialism, imposed poverty, poor housing, and lack of clean water, just to name a few, have had a negative impact on the health and well-being of First Nations children. We found high levels of mental distress among First Nations children and youth. The pattern of mental health indicators such as depression, anxiety, schizophrenia suggests that there is a lack of mental health services for First Nations children, particularly for those living on reserve. First Nations children are 7 times more likely to be taken into care, taken away from their families, and must contend with the trauma that this entails. They are more likely to be involved with justice system, either as a victim or as being accused. Finding these large gaps between First Nations children and other children in Manitoba is heart-wrenching. However, it is important to keep in mind that there are many strong initiatives being developed and implemented. It's important to track if progress is being made in all areas of First Nations children's lives. The Truth and Reconciliation Commission recommended that annual progress reports be made. We, as researchers at MCHP, are committed to supporting First Nations people in doing that.